The Ministry of Health, Wellness and the Environment and the Organization of American States Inter-American Drug Abuse Control Commission, in collaboration with the CARICOM Secretariat, hosted a regional meeting for policymakers and heads of national drug authorities on the Multilateral Evaluation Mechanism MEM 7th round process for the Caribbean, which is a joint effort of the Caribbean Community CARICOM, CICAD, and the Government of St. Vincent and the Grenadines to provide in-depth awareness of the MEM process to the relevant permanent secretaries and heads of drug authorities. The Inter-American Drug Abuse Control Commission, CICAD, is the consultative and advisory body of the Organization of American States, OAS, of the hemispheric drug issue. The Multilateral Evaluation Mechanism, MEM, is an instrument designed to measure the progress of actions taken by the 34 member states of the Inter-American Drug Abuse Control Commission, CICAD. This evaluation is carried out through the elaboration and publication of national and hemispheric reports on the progress in drug control. The objectives of the MEM is to directly strengthen mutual confidence, dialogue, and hemispheric cooperation in order to deal with the drug problem with greater efficacy. It follows the progress of the individual and collective efforts of all the countries participating in the mechanism, indicating both results achieved as well as obstacles faced by the countries. So we're at a high-level regional meeting having to do with drugs, and we have Ambassador Namm and Ms. Sophia Cosmas, and they're pretty much going to tell me about their roles here today and what is intended to be achieved from such a high-level meeting like this. Ambassador.
Hi, thanks very much. Hi, I'm Adam Namm. I'm the Executive Secretary of the Inter-American Drug Abuse Control Commission. I've been in that role for a little over a year at the Organization of American States. And I'm here today in St. Vincent and the Grenadines to have spoken at this meeting and present on the work that CICAD, which is the Spanish language acronym of the Inter-American Drug Abuse Control Commission, what we are doing in the Caribbean, and specifically, and Ms. Cosmas will speak more to this, we are kicking off the 7th round of the Multilateral Evaluation Mechanism, which is a tool for the hemisphere to evaluate all of the countries in the hemisphere. So all of the countries, all of the member states of the OAS get together every 3 years and evaluate the drug policies and programs of the other countries. In addition to that, CICAD, the Inter-American Drug Abuse Control Commission, conducts many other activities in the Caribbean: demand reduction, supply reduction, institutional strengthening, the institution of drug policies, and I was very pleased to hear Minister Brown mention this morning that St. Vincent and the Grenadines has now established a national drug council and will be working on a national drug strategy. Drug treatment courts is something that we also assist member states of the OAS with. And we also have an Inter-American Observatory on Drugs. So in all of these areas, CICAD, the Inter-American Drug Abuse Control Commission, is working to help the member states of the OAS confront the drug problem in their countries, all aspects of the drug problem.
So this is pretty much like an audit and an evaluation, and then you decide on the way forward.
Well, that's what the MEM, the Multilateral Evaluation Mechanism, is an evaluation, and I'll let my colleague comment on that.
So this is an appropriate time to speak to Ms. Cosmas.
Hello, my name is Sophia Cosmas. I am the MEM Unit Chief. The MEM unit is part of the CICAD Executive Secretariat. The MEM process, as Ambassador Namm says, is basically to evaluate the progress done through the efforts of the different member states, the 34 OAS member states, what is the progress that they are doing in their drug policies. The reason why we are here in this regional high-level meeting is to raise awareness of what the MEM evaluation mechanism will be doing during the 7th round, which just kicked this year. We will be holding a lot of meetings. There is going to be a group within the MEM. The group of evaluators is called the Governmental Expert Group, and they're going to be holding a lot of meetings. So with this group, with the permanent secretaries, high-level officials, will try to transmit what the MEM is doing, what the new MEM is all about during the 7th round, how the evaluations are going to be done. The product of the MEM is basically national evaluation reports and 1 hemispheric report. The round is going to last for about 2 years, where we would have a product, 34 national reports, and 1 report that would be looking over what are the efforts being done as a hemisphere. We want to thank in here it's also CARICOM, because this partnership is with CARICOM to get this meeting done. They will be hand in hand with us. We would be doing a national workshop tomorrow, Thursday and Friday, for all the stakeholders, the national stakeholders in St. Vincent and the Grenadines, on how best to present their information. So when the GEG evaluators take a look at the St. Vincent and Grenadines information, it's precise, and it will reveal exactly the reality of the country in their efforts of drug control. The MEM reports will reveal strengths and challenges of normally that's what it reveals, strengths and challenges of the countries.
So we're with Miss Karima Byron Keynes from St. Kitts and Nevis. How do you feel to be at such a high-level meeting like this, to be making a contribution to the process?
Okay, first of all, I have to say thank you to CARICOM and the EU and the Organization of American States through the Inter-American Drug Abuse Control Commission, the MEM unit, for organizing such a timely workshop. This would be the 7th round of the MEM that we are approaching now, and it is important that we meet as a regional body to discuss the different responsibilities that come along with participating in the MEM process. So I feel very honored and privileged to be here. I'm looking forward to the information that will be shared, and also the information that we'll be able to share with our colleagues around this platform.
This is the 7th round. Have you been to any of the other rounds?
I have participated in the 6th round of the MEM, so this is actually my 2nd round that I will be participating in.
And at the end of the 6th one, what was achieved and what determines what you do in the 7th round?
Okay, the MEM is very helpful because not only what is achieved after, but we benefit a lot leading up to the evaluation process, having meetings to figure out where we are as a country with regards to the different pillars that are assessed through the MEM. So it's a way of informing even our local person what services, what activities that we are doing locally. And then following that, part of the process is for a group called the Government Expert Group to meet from around the entire OAS hemisphere, and then different countries evaluate your report and then provide recommendations. So following the 6th round recommendations, St. Kitts have implemented a number of different programs and initiatives to improve the areas such as institutional strengthening, demand reduction in our control measures as a result of the recommendations brought forward from the MEM. So it's a good support tool. How we can improve so that we can reduce the challenges that we are facing with substances.
Okay. So we're Ms. Beverly Reynolds, and she is with the CARICOMs.
Yes, Coordinator, Health and Human Development at the CARICOM Secretariat.
Okay. Tell me a little, just break down this workshop and the importance of it a little bit for me. Non-technical terms, please.
Okay. Well, if you don't mind, what I'd really like to talk about is, because you have experts who will tell you specifically about the MEM and so on, I would want to share about the initiative that we are engaged in with support from the 10th EDF, under the 10th EDF European Development Fund, that is, and with CICAD.
Okay.
Essentially, the program that there are a number of components that are being implemented by other agencies. I'll give you the speech and you see. But there are 2 elements that are being implemented by the CARICOM Secretariat, one of which is a drug demand reduction project. And that essentially is looking at how we can build the capacity of drug demand reduction practitioners, as well as the institutions, the institutional framework, the systems, the data network, how we can build these areas, strengthen these areas across the region, across CARIFORUM, as a matter of fact, because the DR is one of the members, how we can build these institutions, how we can build these
And strengthen
the capacity to deliver the appropriate responses to the whole issue of illicit drugs. Alcohol is really handled under some other portfolio, but the illicit drugs, right? And we are challenged in the sense that, as you would have heard the minister mention, very porous borders across the region, and so you have it makes us really easy prey for the shipment of drugs. But in recent years, well, a few years now, what has been noticed is that the drugs aren't just passing through anymore. Some are staying, and so we have especially our young people becoming users, some of them sellers. And interestingly, sometimes drugs come in to the region. And I think given the large youthful population that we have and the investments that are, placed in our young people, as well as they are the leaders of tomorrow, it is really important that these issues are addressed.
So
and
this meeting covers some of these things.
This meeting covers, as I was saying, really it sets the groundwork, the framework, because the MEM, Multilateral Evaluation Mechanism, as was mentioned, looks at various categories within the hemispheric drug plan and drug strategy and plan. So there's a component that looks at institutional strengthening. There's the component that looks at drug demand reduction, supply reduction, and they make recommendations to each country based on their capacities, based on the findings, what needs to be done to address this. So it's important in terms of a region-wide response.
Okay, an approach to...
Yes, and so the MEM is one of the activities that's going to be the foundation on which especially St. Vincent and the Grenadines seem that it's re-engaged and coming out. So this activity and a number of other activities that are to be undertaken are being supported under the 10th EDF CARICOM Crime and Security Program. And as I've said, we do some of the activities in collaboration with CICAD, but there are also a couple in collaboration with other entities. But we also will be doing some activities that's supported by the CARICOM Secretariat persons. One of which I think is really key is the addressing the whole issue of crime and violence and drug use in schools and communities.
Excellent.
And St. Vincent and the Grenadines is one of the countries that has been identified to benefit from that other activity that will be looking at this issue in schools, the drug use, and so on, and having interventions to address that. We'll be working with the Ministry of Education in particular, but other supporting ministries.
We're here speaking with Mr. Percival of Trinidad and Tobago. You're a participant in today's deliberations. Yes. You're going to tell me what is your role here today and how important you think such a meeting is.
Okay, well, I am representing Trinidad and Tobago in my capacity as the chairman of the National Drug Council of Trinidad and Tobago. The MEM as an evaluation exercise is very important for all the member states of the OS to monitor the progress that they are making with regards to recommendations that they have agreed to in the fight against drugs. And I think that this workshop here today is going to be very useful to all the member states that have representatives here and that have a drug plan to implement, because it gives them an approach, the process that is to be followed, and allows them the opportunity to monitor closely and to take corrective actions to ensure that recommendations are implemented on time.
You've been to several of these meetings. How beneficial has it been on a whole to the work that you do in Trinidad and Tobago?
It is not that I have been to several of these meetings, but in my capacity as chairman of the Drug Council of Trinidad and Tobago, I have had the opportunity, I have been chairman for the last 7 years, I have had the opportunity to work along with the MEM on previous reports. So I have a very good understanding of the process, what is required. And I think that this initiative that is being taken here today is quite a useful one and would be of great use to all the member states here.